I'm pretty keen to get your thoughts on the curfew, the lack of justification from Daniel Andrews. We know now that there was no police advice for it, no chief medical officer's advice for it. One of Melbourne's most senior QCs, Michael Wiles QC, says, therefore, it's not valid. It doesn't fall under the health emergency guidelines, and the law is not valid. What's your view of that interpretation?
Well, I think, Chris, quite frankly, in Melbourne, there's not much we can do in curfew anyway if we were to get out of curfew, because the whole place is locked down. I think the issue here is the perception that Victorians feel that Daniel Andrews is taking away our democratic rights, and it's about locking down or locking the door on our democratic rights, and the perception that he's prepared even to throw away the key. And I think that Victorians and Melburnians in particular are feeling they're not getting the explanation about why these draconian measures.
Yeah, but Daniel Andrews is up there for hours every day talking and saying he's answering any questions. But as you say, there's no actual explanation there yet. I mean, we still don't know. He won't say who came up with the idea of a curfew.
That's exactly right. And I think what we're seeing is a Premier who doesn't seem to be listening to expert advice, whether it's federal expert advice or Victorian-based expert advice. He seems to be going it alone. And I think that's what I'm hearing from constituents and, in fact, experts right across Victoria contacting me and saying we want a more balanced approach. We want, instead of having a roadmap to misery, we want a blueprint for a COVID-safe approach. We want a blueprint of hope. Some of the things that we're being asked to do just don't seem to make sense. As you mentioned, we're down to 43 cases. Now, that's great. We're heading in the right direction. But why not look at some COVID-safe ways to open up the economy? Sole traders, gardeners that are out on their own, they're not seeing anybody. Why do they have to not work? I've had so many local GPs and doctors saying to me, why is elective surgery still closed? We know we're getting containment of the COVID pandemic here. They need to get back to work. They're worried about chronic health conditions amongst their patients and whether they're getting in control of some of the other issues that happen besides COVID. I mean, health and disease continues, and they want to see that they can get back to caring for their patients again. Yeah,
it's a real worry. There's so many impacts here with social, economic, and as you say, health. About, I think, 30% fewer people are going in for checkups for various cancers. Now, that doesn't mean there's going to be 30% less cancer, obviously. It means those people are going to get treatment later. So the bias always ought to be opening up as quickly as you can. And we're seeing the opposite from Daniel Andrews. I may ask you this, you're not only a politician, you are a medico and you have a background in public health.
Look, I've been very clear from the start, really right back in March and April, that the strong decisions made for border control internationally, the control from hotspots was initiated very early by the federal government, a fantastic public health response that has seen Australia having the lowest rate of COVID around the world, the lowest fatality, including the lowest fatality in the aged care sector. So we know that we're doing the right thing, but when we get a letdown like we have here in Victoria with quarantining, it meant that we've had an overflow of cases and widespread community transmission, and then not having the appropriate track and tracing. I'm really pleased that Alan Finkel is going up to New South Wales, taking a team from Victoria with a view to looking to see how New South Wales is doing tracking and tracing, because we need to make sure that that's our best response. We want to make sure that we can open up the economy as much as possible, but work on the things that we know work. Quarantining works. We know that works. We know track and tracing works. We know that good public health messaging works. And we also know that businesses are able to do a COVID-safe approach. So let's work with businesses. I'd like to hear businesses there at the table, making sure that they're engaging about how to get back to business in a COVID-safe way. We're going to have to live with this COVID for a long time. Let's get onto the front foot and work through a blueprint for a COVID-safe economy going forward.
Katie, this stuff was obvious 3 months ago, though. I know I've been sitting here every day talking to experts around the country and around the world, and it was clear that Victoria needed to lift its game on public messaging, lift its game on contact tracing, and the expertise was near it. It's just staggering to me that they've taken so long to get onto it. Is Daniel Andrews, is he isolated? Does he not listen to anyone else? Has he closed himself off?
Well, that's what I'm concerned about. Certainly at the federal government level, there's been a lot of committees that have been put together with experts. So I sit on the National Health and Research COVID Response Committee. There's 35 professors. We meet twice a week, and from that we actually have subcommittees generated around particular topics such as quarantining, such as mask wearing. Those experts are right from across Australia. We discuss and debate the evidence, our own experience, the evidence from Australia, the evidence from overseas, and then we provide that information to the Chief Medical Officer, who then provides it to both the Minister for Health and the Prime Minister, who ultimately make the decision. But we are only one of many committees that have been formed to provide an expert and an evidence-based approach. Now, I'm not hearing about that at the Victorian level, and I know there's a level of frustration by experts here in Victoria about why they're not being listened to, whether it's health experts, public health experts, or even business experts about how to work together to get us out and have a actual map of hope going forward, because the Victorian public really need that right now.
Katie, just on a coronavirus-related issue, but it's more to do with politics and really even the way gender plays out in politics. What do you think of Anastasia Palaszczuk's claims yesterday and today that she's being bullied by your Prime Minister, Scott Morrison?
Look, I think that sometimes people bandy that word around. In my view, she's an elected leader, he's an elected leader. They may have a difference of opinion, and I just don't think that you should be using the word bully because you have a difference of opinion.
Is she trying to portray herself as a victim, and is she using her gender as part of that?
I wouldn't want to comment on that because I think at the end of the day, I'm interested in the merits of the argument. And I think it's very important that Palaszczuk is responsible for her government's decisions, and she remains responsible for those decisions. I think it's very fair and reasonable that the Prime Minister points out when there's been some quite incredible decisions being made that have had an effect on individuals that have been quite staggering. And the cases that we're hearing about are completely heartbreaking. And to not be open to allowing these people to have good medical care or to access funerals at a time of great difficulty, I think sounds heartless to me. And I'd like to hear that she's working with people to make their lives better, not make them worse. And in fact, we're hearing right across the states these terrible cases. I've myself had constituents, they're really difficult cases, and it's much better if we have premiers and prime ministers working together in a collaborative and cooperative way. And I know that there's a lot of complexity to these issues, but, firing arrows is not really helpful in this way. I think we need to work together to try and find solutions for all the people of Australia, because that's what our role is as elected representatives.
Katie, thanks so much for joining us. Have a good weekend.
Thanks so much, Chris. You too.